My name is Samantha Catlett, and I will be informing you on basal cell carcinoma skin cancer and ways to prevent it. Most people do not know the effects and dangers of skin cancer it can cause, or even realize how to get skin cancer. Basal cell carcinoma is the most common type of skin cancer and affects over 1 million Americans a year, according to the Skin Cancer Foundation. Actually, it is the most common type of cancer altogether. 90% of cancer is basal cell carcinoma, according to WebMD.com. This form of skin cancer occurs in the basal cells in the lowest line of the epidermis. Majority of the basal cell carcinoma arises from being in the sun too much, most commonly on the face, ears, neck, scalp, back, and shoulders. The face is the most common place to develop skin cancer, according to WebMD. It is even possible that tumors may develop. Basal cell carcinoma can develop on anyone who has been exposed to the sun. People with fair skin, blonde, red hair, or blue, green, or gray eyes are most susceptible to develop skin cancer. This branch of skin cancer is common in older people, but lately some teenagers and 20 to 30-year-olds have been diagnosed. Men are more vulnerable than women, but the number of women with this disease is increasing rapidly. Basal cell carcinoma is treatable, but the larger the tumor grows, the treatment is more extensive. It is not common that skin cancer spreads to vital organs, but it can damage the tissue around organs, causing damage later on. After having one basal cell carcinoma, it is common for it to develop again over time, either in the same area or even in somewhere else on the body. According to the Skin Care Foundation, there are five possible risks for having basal cell carcinoma. One sign is an open sore that may develop, bleed, ooze, or even crust, and will stay open for weeks just to heal and reopen again. This non-healing sore is common for early stages of basal cell carcinoma. Another sign is reddish patch that occurs on the face, chest, shoulders, arms, or legs. This patch is also may crust, itch, or even hurt. Developing a shiny bump is another sign of basal cell carcinoma. It is pearly or clear, pink, red, or even white. It also may become tan or black. It is commonly mistaken to be a mole. A pink growth may occur that is somewhat raised and has a crusted indent in the center. The growth will grow and develop blood vessels on the surface. The last sign is a scar-like area. This white or yellow area on the skin that appears to be shiny or tight. It is a possible skin sign that can make the tumor larger underneath the surface. Basal cell carcinoma is treatable. The first physician will confirm the disease with a biopsy. There are multiple ways to treat basal cell carcinoma, depending on the size, location of the tumor. Decides the method of removal for the tumor. The treatment process consists of different types of surgery, radiation, laser surgery, and even some cases topical medication, according to WebMD. Although basal cell carcinoma is curable, it is better to prevent getting cancer altogether. The Skin Cancer Foundation and WebMD release some ways to prevent skin cancer. Those ways are to stay out of the sunlight during peak hours of the day, avoid tanning in tanning booths or on the beach, wearing sunscreen higher than SPF 15 every day, and keep infants out of the sunlight. Every month you should examine your body to see if there are any of the 5 signs of skin cancer, and hopefully the numbers of the victims of basal cell carcinoma will decrease.
How do I pause?